Today, our group will be discussing the article, The Benefits of Supervision and a Recommended Structure for Implementation by Valentino LeBlanc and Sellers. The article was published in Behavior Analysis in Practice in 2016. Our presentation will examine why group supervision is valuable in applied behavior analysis, the professional skills it can develop, and the structure supervisors should use to make group supervision effective and ethical. After summarizing the article, we will demonstrate one recommendation component throughout role play. So the main purpose of this article is to explain how behavior analysts can design and implement effective supervision, group supervision. The author emphasizes that supervision contributes to the professional growth of supervisees and the continued development of supervisors, as well as the quality of the ABA field as a whole. One of the article's most important messages is that the group supervision should not simply be viewed as individualized supervision with additional people in the room. Instead, it should be intentionally designed as a teaching and learning environment. So our behavioral objectives for this presentation is by the end of the presentation, participants will be able to identify at least 3 benefits of structured group supervision in ABA, describe 2 supervisor behaviors that promote ethical and effective group supervision, and demonstrate 1 professional response strategy for addressing family concerns about ABA without becoming defensive. So why group supervision matters? So the authors identify 7 major benefits of group supervision. These include peer feedback, professional networking, having multiple listeners for the same event, observational learning, empathy, modeling productive discussions, practicing public speaking, and developing broader professional repertoires. So these skills can be difficult to practice during individualized supervision because individualized supervision only occurs with the supervisee and the supervisor. Having a group supervisor session creates a larger verbal and social community in which supervisees can observe different communication styles, hear different perspectives, and experience the effect of their own personal behaviors on other people. The one major benefit of group supervision is the opportunity to receive and provide peer feedback. So instead of receiving feedback only from one supervisor, the supervisee can hear the perspectives of several individuals. So peer feedback may increase confidence and self-awareness because supervisees learn what they are doing well and what they need additional development for. It also gives them practice in explaining their ideas carefully through being able to listen to different learners. The supervisor has an important role in shaping this process, so feedback should be specific, respectful, and focused on improving performance. It should never be delivered in a way that embarrasses or punishes the supervisee. The supervisor can model constructive feedback and reinforce group members when they communicate professionally. Group supervision also provides opportunities for professional networking. So as supervisees spend time learning together, they begin to understand one another's strengths, experiences, and areas of expertise. So this relationship may continue after formal supervision ends. Former group members may later contact one another to share resources, ethical concerns, professional development opportunities, or seek consultations on different cases. This is especially important because some behavior analysts eventually work in settings where there are only BCBAs or they have limited access to behavior analytic professionals. So having an established professional network can reduce isolation and provide continued support. So these collaborative relationships benefit the individual practitioner and strengthen the ABA field as a whole. Teaching the same information to several supervisees at one time offers benefits beyond efficiency. So first, the supervisor can observe how many people respond to the explanation. One supervisee may appear to understand, while another one may look confused. So these reactions allow the supervisor to clarify and revise the message. Second, the group members benefit from hearing one another's questions. A supervisee may ask something that other members had not considered, and everyone gets to observe how the supervisor responds. Finally, supervisees can teach one another. They may contribute examples, explain concepts in a different way, or connect the topic to their own experiences. Therefore, learning occurs not only between the supervisor and supervisees, but also among peers. Group supervision naturally creates opportunities for observational learning. Supervisees can watch how their peers present cases, respond to questions, accept feedback, and work through professional problems. They also observe the consequence of different communication styles. For example, harsh feedback may cause another person to become uncomfortable or less confident. In contrast, respectful and constructive feedback may encourage participation and productive discussion. These experiences can contribute to the development of empathy. Supervisors can begin to recognize how their words, tone, and nonverbal behavior affect others. The supervisor can strengthen this learning by modeling respectful interactions, acknowledging supportive behavior, and correcting communication that is unprofessional or unhelpful. Group supervision gives supervisees repeated opportunities to observe and rehearse professional discussions. They can practice answering questions, presenting concerns, disagreeing respectfully, and working with others to solve clinical problems. The supervisor should actively model how to respond to different comments and questions. The supervisor must also keep the conversation supportive, focused, and connected to a shared goal. This is important because supervisees are likely to imitate the communication behavior they observe. If the supervisor models active listening, respectful redirection, and productive problem solving, supervisees may use those same behaviors in future team meetings, as well as interactions with caregiver consultations and interdisciplinary discussions as well. So for some supervisees, this may be one of the few opportunities to regularly communicate with the group of behavior analysts. Behavior analysts are frequently expected to speak in groups. They may present assessments results to families, train staff members, and explain behavioral procedures to teachers, or discuss case with interdisciplinary teams. Group supervision creates a supportive environment where supervisees can practice these skills before using them in a more formal professional situation. So they can learn how to organize case information, explain technical concepts clearly, and adjust their language based on knowledge of audience. Peers and supervisors can also provide feedback on presentation style, clarity, as well as body language, visual materials, and distracting mannerisms. In addition to public speaking, supervisees practice broader professional behaviors such as active listening, remaining engaged, contributing appropriately, and avoiding specific activities during meetings, such as completion of those activities. The benefits described in the article do not occur automatically. Supervisors must create a predictable and organized structure for the group. Each session should have a clear objective and an agenda that is distributed in advance. This allows supervisees to prepare and communicate at the meeting with professionalism and purpose. Activities may include reviewing technical terms, practicing competencies, discussing assigned readings, presenting cases, or completing team presentations. Meetings should begin and end on time because the supervisor is modeling professional timeliness. The supervisor should also monitor body language, participation, understanding, and distractions. Notes should be taken, and the meeting should end with clear responsibilities and follow-up actions. A structured meeting helps the supervisor use time effectively while maximizing participation and learning. So for ethical and professional importance for group supervision, so effective group supervision also has ethical and professional importance. Poorly planned meetings may become unfocused. They may allow inappropriate interactions to continue or fail to provide meaningful learning opportunities. So supervisors teach through both their formal instruction and their own behavior. When supervisors arrive prepared, manage their time effectively, listen actively, and respond respectfully, model professional behaviors they expect from supervisees, the overall professionalism improves in both parties. So supervisors must also redirect off-topic or inappropriate discussions and hold group members accountable for their responsibilities. These skills can affect more than just supervision meetings. Supervisees may also later use the same communication, planning, and leadership practices when working with clients, staff, caregivers, and their own prospective supervisees. So therefore, ineffective supervision may ultimately have a negative impact on service quality and client care. For implications for ABA, this article has several implications. Well-designed group supervision helps prepare supervisees to work competently, ethically, and collaboratively, and it can build stronger future supervisors because supervisees observe effective leadership and practice skills that they may later use with their own trainees. It can also improve communication with caregivers, staff members, teachers, administrators, and any other stakeholders. Finally, it promotes generalization. Skills first taught in individual supervision can be practiced in front of peers and later applied in actual professional environments. In this way, group supervision supports both individual professional development and the continued improvement of the ABA field. So this is the connections to the dimensions of ABA. This slide highlights especially four clear connections between group supervision and the guiding dimensions of ABA. First, group supervision is behavioral because it focuses on observable supervisee behaviors. Examples include giving feedback, presenting cases, arriving prepared, participating appropriately, and completing action steps. It is technological because procedures should be clearly described and consistently implemented. Agendas, case presentation formats, competency checklist, and written follow-up procedures provide that type of structure. It is analytic because clinical discussions and recommendations should rely on assessment results, graphs, data, and observable performances rather than just assumptions. And lastly, it supports generality because professional skills should transfer beyond supervision meetings. A supervisee may practice presenting a case in supervision and then later use those same skills with caregivers, teachers, or an interdisciplinary team. So now our handout actually provides more information, and that's in our references. We will now move on to the second portion of our presentation. Our role play will demonstrate how supervisors can structure a group case discussion, encourage professional peer feedback, and guide the group towards clear data-based action steps. So in this scenario, a parent is attending an initial meeting with a clinical director and two behavior analysts. The parent has heard negative criticism about ABA and is concerned that services may focus on compliance, stopping harmless behaviors, or using rewards to control their child. The goal of the interaction is not to persuade the parent that every criticism of ABA is incorrect. Instead, the professionals will model how to listen, provide accurate information, and begin a collaborative and trusting relationship with the family. So just to be clear, the first person is Dr. Rivera, the clinical director, and that is played by Kylie. We have behavior analyst 1, which is Maya, and that is played by Camilla. And we have Jordan, which is behavior analyst 2, and that is played by Jessica. And I am Mrs. Thompson, as well as the narrator. Okay.
So before Mrs. Thompson arrives, I want to review today's goals. This is her first meeting with our team, and she has shared that she has some concerns about ABA. Families may have heard that ABA focuses too much on compliance, tries to stop harmless behaviors, or uses rewards to control children. When a family expresses criticism, we should not interrupt, argue, or immediately defend ABA.
But sometimes it can be difficult not to respond defensively, especially when we feel that the criticism does not represent the way we practice.
That is understandable, but our priority is not to prove the parent wrong. Our priority is to listen, understand the concern, provide accurate information, and determine whether our services are consistent with the family's values.
What steps should we take when responding?
Use the following process. 1, pause and listen without interrupting. 2, acknowledge the family's concern. 3, ask a clarifying question. 4, provide an honest and understandable explanation. And 5, invite the family to participate in decisions. For example, instead of saying that is not what ABA does, we could say, thank you for sharing that concern. Would you be comfortable explaining what you have heard or experienced regarding ABA?
So we should understand the concern before explaining our approach.
Exactly. I will lead the beginning of the meeting. Maya, you will respond to the parent's first concern. Jordan, listen carefully and add information only when it supports the conversation. I will provide guidance if needed.
So this scene will be the initial family meeting begins. So we will begin the meeting with myself as Ms. Thompson.
Ms. Thompson, thank you for meeting with us. I am Dr. Rivera, the clinical director. This is Maya and Jordan, two behavior analysts on our team. Today, we would like to learn more about your child, your family's priorities, and any questions or concerns you have about ABA services.
Thank you. I want to be honest. I'm not sure that I want ABA for my son. I have read it from experiences that I have read from experiences from other autistic adults who say ABA was harmful and taught them to hide who they really were.
Thank you for being open with us. Those concerns are important, and we want you to feel comfortable discussing them. Maya, would you like to continue?
Yeah, I appreciate you telling us that. I can understand why hearing those experiences would make you cautious about choosing services for your son. Would you feel comfortable telling us more about the practices that concern you?
I have heard that ABA forces children to comply, make eye contact, stop stimming behaviors, and complete tasks even when they're uncomfortable.
I understand. Our goal would not be to make your son appear less autistic or to eliminate safe behaviors simply because they look different. We would focus on skills that are meaningful to him and your family, such as communication, safety, independence, or participating in activities that are important to him.
Mm, okay, but how do I know that he will not be forced to comply with adults?
We would want your son to learn that he can communicate discomfort, ask for help, request a break, and say no when appropriate. We would also monitor his behaviors and communication for signs that he is uncomfortable.
We would include you when selecting goals and discussing procedures for him. Before beginning an intervention, we would explain what we are recommending, why we are recommending it, why we are doing it, and how we would evaluate whether it is helping him or not.
I appreciate that, but I'm still worried about hand flapping. My son flaps his hands when he's excited, and I don't really want anyone trying to stop him.
Thank you for letting us know. We would not automatically target a behavior simply because it appears unusual to other people. We would consider whether the behavior is harmful, whether it significantly interferes with something in his life or important to your son, and whether it would changing it would actually improve his quality of life.
His hand flapping is not harmful. It usually happens when he's excited or watching his favorite videos.
Based on what you've described, there may be no reason to reduce it. It appears to be a safe way for him to express his excitement. We would want to understand the behavior in context rather than assuming it's automatically a problem.
That makes me feel better. I have been worried that therapy would focus on making him look more typical rather than helping his functional skills.
That is an important distinction. Goals should be individualized and socially meaningful. We would never want to support, or we would want to support your son's communication, safety, independence, and access to meaningful activities without treating harmless differences as behaviors that must be eliminated.
I also do not want him bribed with candy or toys just to make him behave.
I understand why the use of rewards might sound concerning. Can you tell us more about what you would want us to avoid?
Well, I don't really want him to think that he should only communicate or complete something when he receives candy.
That makes sense. Reinforcement does not have to involve food, and it should not be used to pressure a child into doing something harmful or unnecessary. We may use praise, choices, preferred activities, successful communication, or naturally occurring outcomes. We would also plan to reduce additional supports as the skill becomes more independent.
For example, if your son learns to request a preferred activity appropriately, naturally receiving access to the activity can reinforce his communications. The goal would be to make communication effective for him, not to make him dependent on the actual candy.
I would be more comfortable with preferred activities and choices. I would want to know what is being used and the reason why.
That is reasonable. Your preferences should be documented, and reinforcement procedures would be discussed with you before they were implemented. We have discussed several concerns. I would also like to learn what respectful and meaningful support looks like to your family. What skills are important to your son right now?
Communication is my biggest concern. When he becomes overwhelmed, he sometimes cries or drops to the floor because he cannot tell us what's wrong or what's going on.
A meaningful goal may be teaching him an easier way to communicate that he needs help, wants a break, or feels overwhelmed.
We would first learn how he currently communicates and identify a method that is accessible to him and his preferences. That might include speech, gestures, pictures, or even a communication device if needed.
I would support that. I would want him to communicate what he needs without being expected to speak when he's overwhelmed.
That is helpful information. We would work with you to identify communication options that respect his needs and abilities.
I still have questions, but if you like, but I feel like you listened instead of trying to convince me that my concerns were wrong, and I really appreciate that.
We want you to continue asking questions. You do not have to make a decision today. We can provide additional information, explain possible assessment procedures, and allow you time to decide whether our approach is appropriate for your family.
Thank you. I would like to review the information and schedule another meeting if possible.
Of course, thank you for openly sharing your concerns with us.
Okay, so this is where Ms. Thompson exits the meeting and the group debriefs.
Let's briefly review our performance. Maya, what do you think went well?
I acknowledged the parents' concern and asked for clarification before explaining our approach. I also try to avoid correcting her terminology.
That was a strength. You remained calm and helped the parent provide more specific information. Jordan, what did you notice?
Mize connected the explanation to her parents' concerns instead of giving a general defense for ABA. I also noticed that asking questions helped identify communication as the family's actual priority in this situation.
Excellent observation, Jordan. One of your strengths was explaining that we would examine the content and significance of hand flapping rather than automatically treating it as a problem. One area we would continue practicing is keeping our explanations brief. During an initial meeting, too much information can overwhelm a family. We should pause frequently and check whether the parent has questions.
So, we should provide enough information to address the concern without turning the conversation into a lecture.
Correct. What is one strategy each of you will be using during future family meetings?
I will pause, acknowledge the concern, and ask a clarifying question before explaining.
I think I will focus on the family specific concern rather than trying to defend the entire field of ABA.
Good. For our next supervision meeting, each of you will prepare two additional concerns that families may express and write a brief, respectful response. We will rehearse those responses and provide peer feedback.
Okay, our role play demonstrated how effective supervision prepares behavior analysts to respond to family concerns with empathy, professionalism, and collaboration. Rather than becoming defensive, the team listened, clarified concerns, and included the parents in decisions. Well-structured group supervision helps to develop behavior analysts who are ethical, competent, and responsive to the families they serve. Thank you.